Hi, doctor. How are you?
I'm doing well. Hi, James.
Hi. Approximately 77,115,000 Americans suffer from this particular thing called brain fog, a rare disease resulting from insufficient parathyroid hormone levels. She's laughing at me, and I know why. Historically, treatment options for this have been limited. However, an FDA-approved product could bring a treatment option to patients. Now, here to explain, give us the clinical name and share developments in treatment care is Dr. Marjorie Ann Malvis in Christus Trinity Clinic in Corpus Christi, Texas. Good morning, doctor. How are you?
Good morning. I'm doing well. Thank you for having me.
Well, thank you for joining us. So
Now,
go ahead. Please tell us, first of all, the clinical name and what is it?
so it is hypoparathyroidism, or shortly known as hypopara. It is a rare condition, as you mentioned earlier, that results in a deficiency or insufficiency of PTH. So that means the PTH is low. And why is this a problem? PTH is important to keep our calcium and phosphorus balanced in our body. So if the PTH is low, the calcium is low, and the body really is not able to function normally. Now, the most common cause by far is usually after neck surgery and typically after thyroid surgery, and that accounts for around 75% of the cases.
Now, what are the symptoms of this disease?
It can be quite varied. Some patients complain of numbness or tingling in their fingertips or toes, or numbness or tingling around their mouth, or cramps that are more difficult to manage, to life-threatening ones, such as seizures, difficulty breathing, and bronchospasm, to name a few. And the symptoms can happen quite suddenly or acutely, or even very progressive and long-term, like the kidney disease or kidney failure, brain fog, and also calcium buildup in several tissues in the body.
Now, what are the major risks that those with the disease need to be aware of?
Now, knowing that this is a possibility after thyroid surgery, it really is important to let patients know that if they were to need thyroid surgery, that this may be something that they can have after the procedure. It's also important to know that personalized care is needed for patients with hypopara. And the reason for that is it can be challenging to manage this disease. It's important to communicate with patients and ask them, how they're doing, not only how they're doing symptom-wise, with their medication regimen, how they're handling all that medication, and also if they're having complications and how they're dealing with it. So important to know to talk to patients and treat them instead of just their lab values.
Now, what is key to treating patients with the disease, including latest developments?
Historically, we replace calcium, right? So the disease is the hallmark is low calcium. So we give patients calcium and active vitamin D. But sometimes, in order to do that, some patients need a lot of these medicines. So I actually have a patient who needs 10 to 15 tablets of this combined calcium and vitamin D just to regulate their levels. So that's the problem with conventional therapy. It's burdensome with the number of pills they have to take, and some patients are not adequately controlled with their symptoms on this therapy. And also, it's really not treating the root cause of the disease, which is PTH deficiency. And for these patients, we recommend offering them PTH therapy, and that's where your VPATH comes in. It's the first and only FDA-approved treatment for adults with hypopara living in the United States. Now, not known to be safe if hypopara has developed recently, not known to be safe in kids or in patients who have too low of a calcium to begin with. It comes in ready to use daily self injections that offer a release of PTH over 24 periods of time. Now, don't use it if you're allergic to Yorvipath or any of its component. Some of the symptoms that or side effect of the medication can be too high calcium or too low calcium. That's why you need to adjust the dose when you take the medicine, rare bone cancer, and some lightheadedness when standing up. This is the reason why I'm here today, and thank you for having me. And this is in collaboration with Ascendis Pharma, not only to bring awareness to this rare disease, but also to let patients know or families know that if they're not well controlled on conventional therapy, that there is an option for them out there.
Now, what is a major takeaway you'd like to leave our audience with on this topic?
For your audience who are hearing this, if you or your family member or your loved ones are living with hypopara, please talk to your doctor to see if this medication is an option for you. If you would like more information, you can go to yourvpath.com, and I'm going to spell it out. It's YORVIPATH.com for the full safety information.
I've been speaking with Dr. Marjorie Ann Malbus. She's at Christus Trinity Clinic in Corpus Christi, Texas. The last thing I will say to you, doctor, is for the women's NCAA tournament, good luck, Texas.
Thank you.
You're welcome. Have a great day.
You as well.
Thank you.